Shoulder abduction can be measured with the client seated, standing, or in supine. This video will discuss the standing and seated techniques. When performing the measurement, be sure the individual is standing upright with their shoulder girdle in neutral. A forward rounded posture impedes the motion. There is a higher risk for substitution patterns to occur in standing. When measuring in a seated position, the client is sitting in a chair with their feet on the floor and back supported. Ideally, the chair would be free from armrests, as this can interfere with the performance in the motion and the measurement. The arm is in the anatomical position with the shoulder adducted down to the side, the elbow is in full extension, and the forearm is in supination. To ensure the client's understanding of the motion being measured, provide visual demonstration. Ask the client to perform the motion using the following instructions. Bring your arm over your head like a jumping jack. Once the client has performed this motion, have them return to the starting position. If the client is unable to understand visual demonstration, you may perform passive range of motion. To perform the measurement, the axis is centered on the posterior head of the humerus. The stationary arm is parallel to the spine, and the movable arm is along the longitudinal axis of the humerus on the posterior surface. The client is instructed to perform the movement. Ask the client if they can go any further. Check for proper positioning of the goniometer and for substitution patterns, which can include lateral flexion of the trunk and shoulder flexion. The norm for shoulder abduction is 0 to 180 degrees.